So maybe like me, you got really impressed and interested when you saw a bunch of news stories starting popping up that we had found the cause of SIDS, which is sudden infant death syndrome. That's a phrase used here in America. If you're watching from around the world, maybe your nation has a different phrase. We're going to talk a lot about this condition. So if you have a personal, emotional, psychological reaction to discussions about SIDS due to something that's happened in your life, this might not be the video for you, because we're going to have to talk through some of the statistics of what that claim means. And so we're going to be referencing that quite a bit. So if this is something that you're comfortable to listen through, then go ahead and go through it with me. When I saw that news article, I immediately started having a bit of doubt. Admittedly, I am a pessimistic person when I see big outlandish claims. And that's a big claim, that we've found the cause for SIDS. And it turns out that that is not actually what the researchers claimed, which 100% is what I expected would happen, because sometimes when you get from the actual scholarly article, from the folks doing the research, to the person who has to write the article and therefore sell the ads for the article, the phrasing gets changed a little bit. So you get from phrasing like researchers find cause of sudden infant death syndrome to the title of the article, butyrylcholinesterase as a potential biomarker for sudden infant death syndrome. So what the researchers who put out this study were saying is like, hey, we think we have a potential chemical marker that could show a risk factor for sudden infant death. And that is, I believe, a much more appropriate and maybe accurate representation of where we're at, although there are still limitations to that. So let's kind of nerd out, and we're going to go through the actual study. I'll link it below so you can read it too and kind of go along with me. And let's kind of go through what they did. So this was actually done in Australia. So there are some limitations when you do things in places like Australia, particularly if you are trying to figure out how applicable it is to the United States. Because the United States, just simply from racial and ethnic demographics, we're just not the same as Australia. And so you got to wonder if there's going to be any differences there. And so that's one of the limitations. You kind of put a little asterisk on all these studies that are solely Australian. But this is a very interesting thing that is worth looking into. So what they did is they went through their database records, and they found a number of cases that would qualify as infant death. So this is under a year. And then they kind of parsed out which one of those would qualify as a sudden infant death syndrome. There's some very specific characteristics to that as opposed to other causes of death that can impact infants. And they separated those, and they had a group of children that had succumbed to sudden infant death syndrome and a group of children who had died of other causes. And then they said for each of those two groups, let's get 10 times the number of a control. So we have children who did not die that were separated by gender and by age. And they lined all those up so that there were control groups, both for the groups who died of SIDS and the groups who died of other causes. And then they said, let's look at some of the chemical markers that are present in all four of these groups, the two controls and the folks who died of other causes and the folks who died of SIDS. And let's just compare all of them and see if we find a big difference. And the chemical that they were looking for specifically here was this butyrylcholinesterase. And what they found was it was actually noticeably slightly lower in the group of kids that had died of SIDS. Now, there are some, again, more asterisks here, right? Because when they got these samples was from the initial blood screening sample that's done at birth, a couple days. Now, here in the United States, we do that before babies leave the hospital after having birth, and we test for a number of newborn metabolic screens. And then, weeks later, you get the results back, and your family medicine doctor, your pediatrician goes over them with you. And that's where we get those blood samples from. It's a little kind of stab in the foot. And so we go through that. Now, the thing here is they took those tests and did that. So what you can't necessarily tell from this study is, was the level of butyrylcholinesterase that different at the time of death? And that's a thing that we don't actually know from this study. But we do know that when you took the sample at 2 or 3 days of life and then looked at those numbers in kids who died of SIDS, looked at those numbers in kids who died of other causes, and looked at those numbers of kids who survived through their first year, the numbers are slightly different. There's overlaps, but let's go ahead and put up the picture here so that you can see it. Now, one of the things that you need to point out here is the way that these things work, right? So these are graphs that kind of show you based on the populations of how these things work. So we're going to look at the kids. The red box is the children who died of causes that were not SIDS. The red box on the left side. Okay, so when you look at that, and the blue boxes next to it are the control. So for every one of those children that died of a cause that was not SIDS, they found 9 or 10 cases that were matched by age and gender, and then they marked all those out. And then these are the levels of the butyrylcholinesterase, and this is the references here. And so these did not show any particular correlation between kind of all-cause non-SID deaths and the butyrylcholinesterase, because some of those numbers go up from the controls and some of the numbers go down. So it's kind of all over the place, and you can tell that it's not a clear direction shift, right? Then when you go over to the side of the graph that mentions SIDS, you see that there is a pretty clear trend downward. If you look at the red box on the right and the blue box on the right, there's a pretty clear shift down the chain, down the graph, right? And that's why this researcher group is trying to say that there is a correlation, not necessarily a causation, a correlation between butyrylcholinesterase levels at 2 and 3 days of birth, which is when those tests were done, and potentially a risk of SIDS. Now, what does that mean between correlation and causation, if that's a thing that you're potentially unfamiliar with? One way the way that I like to use is an example for smoking, because it's a thing that a lot of folks are familiar with. Smoking is absolutely proven to be a cause of increased risk of lung cancer. Okay, folks who smoke were probably more likely to have bought cigarette lighters, right? So it would be unfair to say that buying cigarette lighters is a cause of cancer, because that's not real. That's not a thing. But if you didn't know where lung cancer came from, and you just happened to notice that, man, a lot of these folks who have been diagnosed with lung cancer happen to have bought a lot of cigarette lighters, maybe buying cigarette lighters causes cancer. And that would be an incorrect thing, because it's not a cause, but there's a correlation there, right? There's a correlation, but it's not the cause. So establishing cause is a bigger deal. And so when you see these news articles talking about, hey, we found the cause, that's not necessarily a step that we've gotten to yet. And I think it's important to acknowledge that these words are important, and what they mean is very, very specific things. And we need to make sure that we do some more studies about this. I'd love to see some more studies about this. I'd love to see potentially tracking some butyrylcholinesterase levels further into the future. Hit one at 3 months, hit one at 6 months, and see how that goes. I'd love to see us do a study like this here in the United States, where we have a more racially and ethnically diverse population. I think it'd be a really interesting thing. So these researchers, I think, did a great idea. And if they can come up with an applicability here, then the next step is, well, if we find out this is a cause, what can we do about it? Can we supplement this in some way? What can we do with this, right? Those are things that are good questions to ask. But no, we did not find the cause for SIDS yet, right? It is true that this might end up being it, but we haven't proven that yet. And that's a big step. There are certainly resources and things that you can do to try and help reduce risks of this. Co-sleeping can be a risk factor. Look up the safe sleeping guidelines from your pediatrician. They should be able to hand out. I'll include some below. Do all the things that you can to help out and increase the odds of a safe existence for your child. But until then, the researchers are going to be doing their thing, and it's important that you just temper some of the news reports that you see with an attempt to try and actually find out the actual science behind it, because it's not always what the headline says. Stay safe out there, y'all.